Democratic leaders. A briefing from the Capitol. Live coverage just getting underway here on C-SPAN.
Carolyn, Stella. Good afternoon. They say a picture is worth 1,000 words. Well, a number is worth a lot, too. I love numbers. And today, the number from the Congressional Budget Office that this health insurance reform legislation will save $138 billion in the first 10 years and $1.2 trillion in the second 10 years speaks very eloquently to the deficit reduction that is in our package. It also strengthens Medicare. We'll talk more about some other provisions in the bill, and a little bit later today, it will be online. Also speaking eloquently to the need for this legislation in terms of the health of America are the guests who are with us today. I'm very pleased that we're joined by Ed Morris, Kim Adolfsky, Stella Johnson, and Carolyn Coleman. Their personal stories tell the eloquent story of why health care is needed to make America healthier, to lower the cost for America's families' budget while we lower the cost to the federal budget. We always said there were two reasons to do health care reform. One, it was about the health of the American people, to improve quality, to lower cost, to expand coverage, do so in a way that held the insurance companies accountable. The second reason, of course, was to reduce the deficit. The President has said that health care reform is entitlement reform. There's no way that we could continue on the course that we are on. It is unsustainable in terms of the mountains of debt that will be heaped onto future generations unless we intervene with this legislation. Again, let me yield to one of our guests today, Ed Morris. Ed is from North Carolina, and I want him to tell his own personal story. Ed, thank you for joining us today.
Thank you so much. My name is Dr. Ed Morris. My wife and I own a small business, Franklin Health and Fitness Center, in the little town of Franklin in western North Carolina. As you probably know, more than half of small businesses no longer provide health insurance at all to their employees. Well, why is that? Well, our premiums for our business over the last 10 years tripled. This is a huge cost for our business every year to pay these health insurance premiums. Well, why are our premiums so high? Well, we as a small business are in such a pool that we cannot spread these costs around. One of our employees had cardiac bypass surgery about 8 years ago. Well, the next year, when the insurance company got these legitimate medical bills, our premiums went out the roof the next year. So to keep offering coverage to our employees, we had to do two things. First of all, we had to raise our deductibles from $250 to $3,000 for an individual. And secondly, we used to pay 100% of the premiums for our employees. But in order to continue to have coverage, we now require the employees to pay up to 40% of their own premiums, and many of them simply can't afford that. Well, what will this bill do to help us? Well, first of all, we'll be in a big pool, so our costs will be much lower. And secondly, it will prohibit insurance companies from raising our premiums if an employee gets ill and actually has to use the insurance. And third, and probably most importantly for me as a small business owner, beginning this year, I'll receive tax credits of up to 35% to help cover the cost of these premiums. This will help me continue to provide health insurance for my employees and possibly to hire some new employees and to grow my business. Our congressional district has one of the highest rates of uninsured of anywhere in the country. 23% are uninsured in our district. We have over 700 bankruptcies every year just in our congressional district. And every year, hundreds of my friends and neighbors suffer because of lack of adequate health insurance. And these hundreds of medically related bankruptcies and this huge burden that us small businesses have, businesses just like mine in our little mountains of North Carolina. So I'm here as a small business owner to urge my congressman, Congressman Heath Shuler, and really all the members of Congress, both Democrats and Republicans, to do the right thing, to help us small business owners, to do the right thing for our employees, to do the right thing for our local economies, and to do the right thing to reduce our national deficit. So I'm urging Congress to say yes to this health care bill this week. And now I'll turn it over to Leader Hoyer.
Thank you very much. I should have kept that, because if I just repeated it, I think it's right on message. I think Dr. Morris was excellent, and he made all the points. I'm going to make them again because they bear repeating. First of all, as the Speaker pointed out, we know that in trying to stabilize this economy, grow jobs, and get our country back to work, we've had to incur deficits. We know that the fiscal soundness that we had in the 90s was dissipated in the last 10 years. We need to get back to balance. This bill is the biggest deficit reduction bill that any member of Congress is going to have the opportunity to vote on. $138 billion reduction in the next 10 years, and over the next 20 years, $2.2 trillion plus reduction in the deficit. Excuse me, $1.4 trillion reduction in the deficit. Now, Dr. Morris, of course, spoke to that issue as it relates to him. Because every American that's watching us with health care says, what does it do for me? How does it impact me and my family and my security and my availability of health care? First of all, let me talk about small business. America has the highest health care costs in the world. And that's not just harmful to America's families who see their premiums rise year after year, as Dr. Morris pointed out. It's harmful to our job-creating small businesses who see mounting competition from foreign companies with lower health care costs, who face the painful choice between laying off employees and dropping their health care coverage. Health insurance reform helps relieve that burden. It creates an insurance exchange, a marketplace where private insurance companies will compete to attract customers. That's what Dr. Morris said. He'll be in a big group, not a little group, and we know that big groups are cheaper and more reliable. Health insurance reform helps relieve that burden, where individuals and the small businesses will be able to pool together for the same purchasing power and lower rates that have only been available to the biggest businesses. Small businesses will also see a $40 billion in tax credits. Dr. Morris spoke to that as well, which will help him provide health insurance for his employees. That's good for Dr. Morris, but by the way, it's very good for his employees and their families. If we pass health insurance reform, as we will on Sunday, those tax credits will begin to kick in immediately. But if reform fails, the trend of shrinking coverage will continue. According to the Robert Woods Johnson Foundation, the number of small business employees who can buy plans through work will be cut nearly in half by 2020, from 41% today to 23% in 10 years. Now, what does that speak to? People who say, look, I've got insurance now. Why am I concerned about this bill? They're concerned about the bill because they're losing it at a rapid rate, because the businesses for whom they work can't keep it. And if they can keep it, they have to lower benefits very substantially, increase copays and premiums very substantially, and people are being priced out of the marketplace. So I'm very pleased to be here with Dr. Morris. But I'm also pleased to be here with Kim Polofsky.